Hi, I'm Dr. Scott Connard. Welcome to CVTV. We're here with Dr. John Osborne today. We're going to talk about things you can buy over the counter that will help you live a longer, better life. John, if you only had $25 to spend a month in supplements, what would be the one thing you would take to help you live a longer, better life?
One of those things I would do, just because we have a wealth of evidence, we understand its effectiveness, the safety of that, would be an aspirin a day. If I had to do one thing, an aspirin a day, that frankly will set you back maybe $5 a year.
Oh my goodness! So, how many milligrams? Is it 81, 162?
In most people, it's going to be 81 milligrams would be the dose that would be the best dose for you, both maximizing the benefit and minimizing any risk.
So that's baby aspirin.
A baby aspirin.
Okay, and so why am I taking this? So I'm taking a baby aspirin, it goes in my mouth, in my stomach, into my blood. Who cares? What's going on?
So for people at risk of heart disease, just taking that baby aspirin a day lowers your risk of strokes or heart attacks by roughly 25 to 30%.
Wow. So how does it do that?
Well, what it does is it basically thins the blood. But what we really mean when we say thinning the blood is we really mean it makes the blood less prone to clot. Because the vast majority of strokes and heart attacks are actually caused by blood clots within our blood vessels.
So that plaque that you talked to us about earlier, the plaque, which is a toothpaste-like gel or like the inside of a pimple on the wall, when it breaks open and a blood clot forms, it blocks the blood vessel for everything downstream?
Absolutely. And that process occurs within seconds to minutes. That's why many people feel fine, no symptoms, no chest pain, normal stress test last week. When that pimple ruptures and it forms a clot within seconds to minutes in that blood vessel, you have a heart attack or a stroke, or worse yet, even kills you.
And if I take an 81 milligram baby aspirin one time a day, it's going to decrease that by 20%.
25 to 30%.
25 to 30%. Wow, that's a deal. I'll take that. $5 a year. That's the first
World's
thing.
cheapest life insurance policy.
All right. What's the second thing you're going to take?
The other thing would be omega-3 fatty acids, or fish oil. Fish oils are effective. They're safe. We know from a variety of studies that they significantly lower the risk of cardiovascular events.
All right. So let's go by why. So a fish oil goes in my mouth, in my stomach, it goes into my blood. Why does that make a difference?
Well, fish oil has a variety of beneficial effects on us. First of all, it affects our cholesterol levels and particularly helps to lower the triglycerides. This is one of those nasty fats that builds up in the blood vessel walls. It also raises our good cholesterol, or the HDL cholesterol. So it has effects on cholesterol. It also has effects on the platelets and, again, causes our blood to be less prone to clot. So preventing those blood clots, sort of like aspirin in a sense. And then thirdly, it also probably has direct membrane stabilizing effects.
All right, so let me try to describe that for those who are watching CVTV. The way I think about this is that every cell in our body, and we're just a whole millions of cells all kind of sitting next to each other, stuck together, and a cell has a little, it's almost like a balloon, and the outside of the balloon has fat in it, right? And if that fat is like grease from when you eat hamburgers and French fries and things, I have a visual image of, you know how you fry bacon and then it cools down, that white stuff? So what you're saying is that instead of our cells, the bags around our cells being filled with all that white stuff, that somehow the fish oil knocks that out and it replaces it?
Absolutely.
And why is that important?
Because what happens is when there's lots of bad fat in these membranes around our cells, they become electrically unstable. If we replace that bad fat with good fat, such as omega-3 fatty acids or fish oil, those membranes are they're chilled out. They're calm. They're not going to become electrically unstable. And when heart cells become electrically unstable, that is what we call ventricular fibrillation, ventricular tachycardia. That's when we have to shock people, and that's what kills many people with their heart attacks, is that rhythm that can be a very quick onset and quickly lethal rhythm.
Okay, so to put this back into something that's a little easier to understand, so I take the fish oil, it goes in my mouth and in my stomach and in my blood, and then it makes my cells calm down a little bit so that if there's any, like a plaque breaks open and a blood clot forms, it's less likely for those cells to go nuts and start beating out of
It's like
control.
a seizure of the heart. And these fish oils help to reduce the chance of your heart going into seizure.
Fantastic. And do you take 2, 4, 6, 8, 10 a day? What do you think the right number is?
Well, there have been 2 large studies. One was a study looking at 11,300 people after having had a heart attack. They gave them 1,000 milligrams of omega-3 fatty acids, fish oil, followed them out over 3.5 years. Just doing this lowered those people's risk of all-cause mortality, death from any cause, by 20%, the risk of a fatal stroke or heart attack by 30%, and the risk of sudden cardiac death, killing over dead, by 45%.
My goodness. So the 2 things you're going to take every night is a baby aspirin and fish oil, usually 2 pills.
The stuff we buy over the counter, usually about two of those capsules a day.
At bedtime.
You got it.
All right. Anything else, any third product that you think we should talk about?
Well, the other thing that we can get over the counter that is available is niacin, or vitamin B3, which has been shown, particularly in conjunction with other medicines called statins, to be very effective at treating plaque and actually helping to reverse plaque, and been shown in studies where we're looking at plaque in the carotids, plaque in the heart, to reverse that, and more importantly, beyond just reversing plaque, showing dramatic reductions in heart attacks and cardiovascular events and need for balloons and stents and bypass surgery, reducing that risk up to 90%.
My goodness. So niacin is a good vitamin to be taking.
It is.
And you can get it over the counter. Some people experience flushing with the stuff you have over the counter.
Because of the flushing, there are pharmaceutical preparations of niacin that really dramatically lower the flushing and much better tolerated. So usually when we recommend that, we do recommend the pharmacologic form of niacin, just much better tolerated, easier to take.
Fantastic. Thank you, Dr. Osborne.
My pleasure. Thank you, Scott.
So there you've got it. Dr. Osborne has shared with us the importance of a baby aspirin, 2 fish oil tablets at bedtime, and consider taking niacin if you have too much flushing from the stuff over the counter. Then come into your doctor and get the niacin that is low flush, that is safe. This is CVTV. I'm Dr. Scott Connor. Thank you very much.